is Maria Lopez Hernandez, and the theory I chose to talk about today is the person-centered theory, which was one of my favorite theories that we taught in class this semester. Person-centered therapy is also known as PCT, which is a humanistic approach in psychology. It helps others for developmental self-healing and fulfillment. It does not focus on direct techniques, which is that direct techniques plays an active role focusing on the client's problem and helps resolve them. This theory helps create a non-judgmental environment where individuals and patients can feel safe talking about their feelings and thoughts. This theory is not to give advice to the patient, better for them to find self-discovery and personal growth. A person-centered approach helps prioritize the individual's needs and values and ensure they are at heart and they are supported no matter what, with no judgment. This approach is commonly used in therapy, healthcare, and workplace. Carl Rogers, an American psychologist and the founder of humanistic psychology, he's also the creator and founder of person-centered therapy, also known as PCT, and advised respectful listening and have a good relationship with the patients and clients. He believed that individuals could reach their full potential when they have unconditional positive regards. Unconditional positive regard is one of the core conditions / elements that we will talk about further into the presentation. What is person-centered therapy? Person-centered therapy is a humanistic approach. This therapy includes, which I got these 4 bullet points from the textbook. The therapy includes the therapist trusts the clients, therapist's whole attitude towards the client's congruence, unconditional regard, and independent understanding. The therapeutic relationship is a mechanism of change. Therapist does not educate clients, interpret their conflicts or identity, falsely thoughts or behavior. Instead, they establish relational conditions that allow clients to engage in national self-discovery and personal growth. The humanistic approach in psychology is basically focusing on the unique experience and potential growth of others. It's not a good fit with medicine modern because the therapy's clients because the therapy view clients as the experts. They're the experts of their own lives. It's a form of talk therapy where the client does the talking half of the time and the therapist is just there to listen. PCT mainly focuses on emotions and emotional expression, which PCT is a non-direct approach where the clients mostly have the conversations and the therapist is there as a guide and like moral support for the client. The 3 main core principles of PCT is unconditional positive regards. The therapist creates a safe place for the clients with no judgment, which is the acceptance and valuing of a person regardless of the behavior and thoughts. And the therapist respects the individual's rights to their own thoughts and feelings and experience. So if the therapist is Catholic, then the client is Christian or another form of religion, the therapist has to respect their beliefs. Independent understanding is where the patient clients are valid and respected as a whole individual. The therapist understands the client from their point of view. And congruence is the last core principle that we will be talking about, which is the therapist is honest and transparent with the client. The goals for PCT is self-awareness, personal growth, self-acceptance, help with depression or anxiety, or also help with identity issues. So the core principles help with these type of goals for the client/patient to fulfill. On this slide, I have 2 different types of scenarios of PCT. which scenario 1 is a client with anxiety or depression can use PCT to find what is causing their anxiety or depression and help to gain control of their own feelings. Another scenario of PCT is a therapist may use PCT when the client comes in with identity issues and looking for self-acceptance and personal growth, which the client mostly does the talking and help find their own personal growth and self-acceptance. And that's all I have to say about person-centered theory slash therapy. Thank you for listening. I hope you guys have a good day.